Right. So let me start, the talk, today proper. Today, what we have here is, Dr. Roland. Dr. Roland itself is a specialist, in shoulder. I'll probably not want, to help to introduce too much because I'm not really, that good on medical itself. But basically, I ever had a bad, shoulder injury. And then, basically trying way too hard to do push-ups, whatever, probably in the wrong technique or whatever. Yeah, he got me done, he got me settled, in one session itself. Yeah, so today we are very, very honored, to have him with us, in collaboration, with Pathfinder. So over here, I see, a list of, some of my Pathfinder colleagues and also some, who are also the customers, of the Pathfinder consultants. We're doing this, to probably hope to let everyone, pass their time, much faster, during this circuit breaker, period itself. Right. Hope that all of you guys have taken your lunch, right? And without further ado, Roland, you can start your video. Probably they would like to see you. Yeah. So without further ado, I'd like to probably, hand over to Dr. Roland, to start this talk. And you guys can actually, key in your questions, in the chat box itself. And then we'll probably answer it during the Q&A. The talk itself will probably take about 30 minutes, I think. And then after that, Dr. Roland will probably handle the questions from there. Just one more thing. Some of you, when you enter, you realize that, this video is being recorded itself. It's actually just meant for, their future reference and training purpose. All right? Okay, sure. Then I'll hand over to Roland over here. Over to you, Roland.
Thank you. Hello, everybody. Thank you for coming to join us today. My name is Roland. I hope you can hear me. Can you all hear me? Can you see the slides also? I think it should be pretty okay.
Both okay.
Yeah, okay, Ken. Thank you so much. Okay, so my name is Roland. I'm a shoulder elbow specialist. Essentially, I'm an orthopedic surgeon by training. We are essentially mainly a shoulder elbow specialist clinic. I'm affectionately known as Roland Shoulder among the cycling and the gym community. I see a lot of such injuries, so whenever they run into trouble, they will often look for me. And during this CB, right, it was actually very interesting. We are very blessed and also very, very honored to be able to be considered as essential service and continue working. Normally, you would think that the number of injuries and everything would be decreasing, but because of essential services, we actually do see an increased number of injuries to the shoulder or any other joint during this period of time, because we do see some people getting more and more injured. So this time around, I spoke to Desmond and I said that maybe we should tell people actually how to protect their shoulder during this period of time, so that when everything is okay, when you can go back again, right now, at least you have something that is stronger and better equipped for yourself when all this CB is over and you can actually go back to your activities outside. So the topic today I'm talking about is do not be a COVIDiot. Essentially, is how do you protect your shoulder during this CB. So I'll just tell you something simple about my group first. I come from the Shoulder Elbow Orthopaedic Clinic. There are 3 of us. Our mission is to change lives, one shoulder at a time. So we believe that shoulder and elbow injury often affects your daily life, and it often takes your game away. So what we do here is that we help try to find the root cause of the pain, the really root cause of the pain, and then help to gain back your health. And we believe that you don't have to suffer because of this shoulder and elbow pain. So we have 3 pure shoulder elbow specialist surgeons. With the 3 of us, we form the largest group of pure shoulder elbow specialists, whether private or public in Singapore, essentially. So let me, without further ado, let me entertain you. This is us doing the Zooropa move, the Zoolander move. Sorry, trying to look funny, but I'm here to entertain you this afternoon. Okay, before we can talk anything about the shoulder, we must ask what is the function of the shoulder first. The shoulder in a male right now has 2 main functions. Number 1 is to wash hair. Number 2 is to clean backside. That's the 2 most important things you need to do with your arm. For females, you need to have 2 same things, wash hair, clean backside, but you have 1 more very, very important thing with the shoulder, is to hook the bra. You cannot imagine how many times patients come and see us to tell us the only reason why I'm coming to see you now is because I cannot hook my bra. It's so painful that I cannot hook my bra. So that's why we learned that in orthopedics, that's what we do. It's all about function. we are not aesthetic physician, so we don't look so much into the beauty of it, but we always see how it actually affects you in terms of function. So bearing this in mind, we actually then go into seeing how we can actually help everybody. So the next question we want to know is, what exactly is the shoulder joint? The shoulder joint, right, is a golf ball sitting on a golf tee, like that. So if you look at the shoulder joint, golf ball, and golf tee, the golf ball is 3 times the size of the golf tee in terms of the diameter. It is actually one of the most mobile joints. Actually, it's the most mobile joint in our body. And if you look at the shoulder, around this shoulder joint, there are 4 main tendons. Tendons, we call it kun or jing. The real Chinese word is actually not jing. It's actually called jijian. So this one, if you look at your hand, you can see this thing that sticks out here. That is a tendon. It joins muscle to bone. So when you buy chicken wing or chicken drumstick, you can see these long white lines. Those are actually called the tendons. So again, remember, tendons join muscles to bone. Okay, so these 4 tendons, on top of it, there's actually a piece of bone here. So these 4 tendons, and on top of it, there's a piece of bone here. You can actually feel on your own shoulder. It's called the acromion. Everybody has it. So if you look at it in this way, right, these 4 tendons and this bone, it forms a house. There is a roof tendon. There is a front door tendon. This is the front of the shoulder like this. And then I flip it around onto the back. There is 2 back door tendons on the back. On top of the roof tendon, there's a piece of bone, like a branch coming down like that. Now, if you keep knocking the top part of the roof tendon on the underneath surface of this bone, the branch, after a while, you will start getting roof tendon problems. Now, again, you look at the roof tendon. The roof tendon is not made of a metal rod. It's like a rope. It's multiple fibers. So, of course, if you start injuring the roof tendon, you can start getting damage to this roof tendon. And I'll tell you how it actually affects you. The main thing about this is that it's all about the lifestyle. Shoulder problems is not a life-threatening condition. It is truly just a lifestyle issue. You will not have any major danger to your life from having a shoulder issues. It just makes it very, very irritating. So what do patients come and see us? They tell us that they have loss of their lifestyle function, cannot raise the arm up to lift at all, cannot sleep on the side at all, end up sleeping. So one of my patients tell me, I cannot sleep on my left, I cannot sleep on my right. I cannot sleep on my back because when I sleep on my back, I snore a lot and my wife hits me. So I sleep on my face. And that also causes a lot of problems, like reflux and everything. So of course, the other thing is not just even your life, your daily life. What about your sports, your lifestyle? This is Charles Barkley trying to play golf. It can also affect your ability to do your sports. So what are the common causes of shoulder problem? So there's this old professor that I put here. His name is Professor Bala. He's actually a late Professor Bala. He's actually one of our what we call our grandmasters. So we affectionately call him the Grandmaster Yoda. He always tells us that common things occur commonly. So if you see now a bird along Orchard Road, do you think it's a penguin or is it more likely to be a pigeon in Singapore? In Singapore, it is more likely to be a pigeon. So we look at the pigeons first. We don't go look for the penguins. So in pigeons, right now, the most common cause of shoulder injury is what we call rotator cuff, which is the 4 tendons that I told you injury. Of course, you can get other problems like frozen shoulder or what we call labral injuries. So I won't talk about those 2 first, but if you ask any shoulder specialist, we will tell you that the rotator cuff injuries easily outnumber all the other problems, including frozen shoulder 4:1. So that's the common problems that we see. Okay, so a rotator cuff problem is also known as suffering a Sharapova. Why? Because Sharapova actually did have a rotator cuff injury, which she actually went for surgery twice since 2008 to solve this problem. And if you notice the way she walks like this, what we call a protracted shoulder, and that puts her at a very, very high risk of getting this kind of problems. And I'll explain to you now what exactly suffering a Sharapova is. It includes a few different things. Number 1, impingement. As I told you before, this is a cheap word of what we call it. Like, think of it now as the branch go and langa the roof tendon. So if you look at it, the tree branch now crash down and hit on the roof tendon. Of course, the roof tendon can start causing problems and start giving you pain. If you keep rubbing the roof tendon, after a while, you may have what we call micro split tears within the tendon itself. The chim word we use is tendinosis, which essentially just means, think of it this way, the branch knock on the roof on top, then the roof after a while, the termite go eat inside and then cause micro split tears within the tendon itself. So that's the first level. So sometimes you see the doctors will tell you, oh, tendinosis. That's just all what it means. The tendons got some micro split tears inside. Of course, after a while, if you keep rubbing and rubbing, blah, 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 the roof tendon can start giving you problems. You can get what we call a partial tear. Think of it like the few tiles broken off. Sometimes you can have the roof tile broken off. Sometimes you can also have the false ceiling that is actually damaged. So that's what we call a partial tear, a partial thickness tear. If you keep progressing and progressing, or if you get a very, very bad injury, you jam on the shoulder or something like that, you can actually get what we call a complete tear, where there's a whole hole on the roof tendon, like chin long like that. As you can see, a big hole on the roof tendon. Of course, when you have a hole in your roof tendon, when it rains, nobody will be happy inside the house. It can give you a lot of problems in terms of pain and loss of function. That means inability to lift up the arm. So a complete tear is also known what we call a complete rotator cuff tear. You see a lobang in a hole on the roof tendon. I think that's one of the main problems that we do see quite a lot, causing a lot of issues with their day-to-day life. So how does it affect a sports person, an athlete? You will find that they cannot play golf. You can imagine how difficult it is. Eventually, after this CV, when we all can go back to play our sports, we cannot play racket games, whether it's badminton or tennis. Even swimming is a problem, especially this one, which is a butterfly stroke, because when butterfly stroke, you need to actually do a lot of lifting your arms up like this to help to get you to get the stroke in. Even cycling is a problem, whether you're cycling in a road bike or a mountain bike, because of the way you're putting the arm down like this, the vibrations coming up can cause you a lot of pain in the shoulder area. Of course, going to the gym can cause a lot of problems also, because you cannot lift up towards this way. Even yoga, many people tell me, oh, yoga is actually quite safe. True, but you look at this is a downward dog. A downward dog is an overhead activity, and that actually can cause quite a lot of impingement, because you are literally jamming the top part of the roof tendon on the underneath surface of this bone. So you can actually cause problems with that also. One of the issues we also do see is contact sports. Because I see a very skewed type of patients. I see quite a lot of national players. So we do see the MMA guys getting a lot of injury. We also see, this is actually, I'm Aussie trained now, so this is actually Australian Football League. This is footy. They can get a lot of back shoulder injuries from a direct impact contact sport. And of course, locally, we see a lot of the rugby players getting it also. Okay, so as a day-to-day thing, how do we know? How do we know that this is giving us problem, giving us any issues? The three things we always ask for is pain. Is how bad is the pain? Where exactly is the pain? As you can look at this picture, the pain typically from the shoulder comes here. Shoulder pain usually do not give you pain here in the neck area and doesn't give you hand numbness. The typical pain is usually around this area, what we call the deltoid area. Typically, that's where we get a lot of the pain. And because with pain, you may get some stiffness. And because of the stiffness and the pain, you realize that you cannot have good function. Like, for example, this guy cannot actually grab the bus or the MRT handle. So that's one of the things that we actually know. Again, it's all about function. So for the rotator cuff, what kind of function for day-to-day? I always ask three questions: sleeping, wearing or hanging clothes, and washing. So this is what we call activities of daily living, which is sleep, dressing, and washing. Without these three functions right now, you will have a lot of issues. So usually I tell patients, if all are okay, okay sleep, okay wearing clothes, and okay washing, you don't need to see me, and you probably won't need anything to be done also. If you tell me all not okay, then you tell me, please, can you do something about it? So typically that's what we ask for also. So sleeping, dressing, and showering, and washing hair, okay? So in all forms of orthopedics right now, we always look in these three ways. What I was talking about is what we call injury management. That means we manage the injury, whether it is seeing a GP or seeing a physiotherapist or seeing a doctor. We always try to manage the injury. Of course, you don't want to come to this state. That's why we talk about injury prevention also. How do you protect the shoulders better to prevent such form of injuries? So injury prevention can be done by doctors. The physiotherapists can help also. Sometimes even the personal trainers, who are well trained, can also help in terms of injury prevention. Of course, the next level, the most advanced level, is we can do performance enhancement. That's a different thing. So this is the way, as a Mandalorian say, as you can see, I'm quite a Star Wars fan. Okay, so injury prevention. So everything comes in threes. If you notice, everything I will say comes in threes. Very easy to remember. The first thing we do is what we call activity modification. Change your habits and how you can actually prevent this from getting injury. Then we talk about addressing the house tendons. That means the roof tendons, the rotator cuff tendons, which is called the RC tendons around the shoulder. And the technique we use is called the slowly, which is the eccentric technique. And then how we preserve and protect these tendons. And then we help our neighbors. That means the muscles around the shoulder, we call the scapula, the shoulder blade area, which is this one. How do we help to stabilize and to recruit and train these muscles to make it better for the rotator cuff tendons to function? So that's how we do it. So I'll go through it one by one now. Okay, activity modification. The key will be this. You want to reduce overhead activity. The more you do overhead activity, the more you're going to have problems. So example, cooking. So if you look at this little boy and this guy cooking, when you put your stove very, very high up, and you end up having to do a lot of this to actually cook, whenever you lift up shoulder like this, and especially when you turn inwards, we call it an internal rotation action. You actually jam it on the top and turn it inwards, and you rub on the top tendon. That can cause a lot of problems to the top tendon. That's what we usually do see. So that when you keep rubbing and rubbing like this, we find that the tendon can actually get damaged. So we do see quite a lot of cooks and chefs who actually, or even housewives, that suffer from such problems because of this issue. So the way to actually resolve it is to, unless you are very, very tall, like this gentleman here, you either is to keep your elbows tucked in and just cook at this low level. So sometimes you may want to either put a standing stool so that you can actually stand on it so to prevent it from doing like this, or you may want to reduce the height of your stove. So that can prevent your arm from doing this. In the same sense, if you think about it, even ironing like this can cause a lot of issues because you're rubbing on that. So if you keep your iron board lower and you iron with your arms like this instead of like this, you can reduce the chance of injury. Okay, the other thing that we see a lot of injuries from this is actually hanging clothes. So especially this is the old style, when you hang up onto the clothesline like this, if you're lifting up all the time, especially if it's a wet, heavy, say tilam, which is your mattress cover, and they can cause, or even curtain, that can cause you quite a lot of pain in the shoulder because you're lifting up all the time and you're jamming on the shoulder. So we recommend, again, if you can, either you bring the clothesline down, or like this little girl, you stand on a small ladder or stool to help to keep your elbows down like that, so you don't end up having to lift up like this. The other thing we see a lot is in the housing estates. This thing is actually not too bad already. If you notice, there's actually an area where you can rest the teko, the bamboo stick on the side. The old style where you have to push out and hook in, this action causes a lot of problems. When you're trying to lift up and then you try to engage it in like this, you cannot imagine how much we have seen injuries, especially when it's all filled with clothes and it's very, very wet and heavy. That can cause a lot of problems. Of course, we have the time when he was still the housing minister, the HDB side on. You have new techniques to actually help to prevent you having to do this, to help to hang the clothes like that. Try to use this as much as you possibly can. If not, then at least try not to use too much force, and maybe don't put so many clothes on the teko, on the bamboo stick, so that you can reduce the forces on the shoulder. Okay, oops, sorry. Yeah, correct. So the last thing will be going to the gym. And the thing we always say is that if you do go to the gym or you go to exercise, try not to go beyond your limits. Try to keep the ego at home. And I explain to you how we actually can do that later. Okay, so again, now we talk about house tendons, how to protect and preserve your house tendons. Okay, the first thing you must understand is that the tendons were never designed to stay still and don't move. Many patients come and tell me, hey, I got this injury. Then I don't do anything for about 2 months. Then it is better. Then when I move, it comes back again. Yeah, so the tendons were never designed for you to stay still and don't move. If you really, really stay still and don't move, after a while, you become stiffer and stiffer, and that becomes a problem. Tendons heal by movement because the movement nourishes the tendons. They were designed to move, but there's a specific type of movement that will let the tendons heal. Remember, I told you the micro split tears within the tendon itself. So this specific type of action will actually help tendons move. So I'm going to tell you now how we can actually help the tendons heal by using this type of specific action. So this is called an eccentric training. When you contract your muscles, like your biceps or any other muscles, the contraction part is known as a concentric contraction. And when you slowly holding the weight, slowly relax, that's called an eccentric contraction, the relaxation phase. So we realized that from studies that the relaxation phase, if you do it properly, actually does help the tendons heal. In fact, we always tell people this, that your body does not have a weighing machine inside you. I know many guys go to the gym, or many girls go to the gym, and they want to carry heavier and heavier weights. The point is this: the body does not recognizes how much weight you carry. Most of us are not training to become power lifters. Of course, if you want to be a power lifter, you want a sudden burst of energy. Yes, you need to get the sudden power, the burst of energy that you come from. Then you need to carry heavier and heavier. If you're looking at toning the muscles and making sure that you are you can lose weight, you can make sure that the muscles are stronger, you can make sure that the joints are protected. Generally speaking, we say this, that the body recognizes actually the time it maintains the muscles in tension. So the time it maintains in tension actually helps to let the body realize how much growth it needs to go. So this eccentric slow relaxation phase actually seems to help with the muscle growth, the hypertrophy, we call it the hypertrophy, the muscle growth, a lot more than carrying a lot of heavy weights. So that's what we realize. And we find that this eccentric training actually help the tendons heal. So how do we do this slow relaxing phase? Okay, you know, when you do any exercises, when you do push-ups or anything, you will know that it is when you do it slowly, it is a lot more tiring than you do it very, very quickly. So the best tempo we find is this. When you're doing exercises, the relaxation phase, you count to 4. Then at the maximum relaxation, you hold for 1 second. And when you contract it, you count 2. So same thing, whatever exercise you do, you count 2. And then when you slowly relax, you count to 4. So now that's how we understand. We understand that this slowly way of doing it seems to help to let the tendons heal. And that's what we find very useful for tendon healing. This is true for most of the tendons in the body, including the tendon Achilles, which is the heel tendon, including the biceps tendon, including the shoulder tendon. So that's not a problem. We understand that. That helps quite a bit. Okay, then I'm going to specifically teach you now how we can actually preserve this tendon using specific exercises. So first thing is we preserve it by not rubbing on the tendon. I will show you some simple exercises that we often do and how to use specific techniques to do this. Okay, this is me doing a push-up. Don't do it in a T-shaped action. Yes, don't do a T-shaped action. You want to bring your elbow down, do it like an arrow shape. You don't have to bring it down like that. This will be using mainly your triceps, but you want to do it like this in an arrow shape, 45 degrees, and that helps to prevent it from rubbing on the shoulder tendon. Yeah, so you do it slowly. So again, when you're doing the push-ups, instead of doing a T shape, what we call keeping your shoulders flat up like this, you drop your elbow down, keeping it in the arrow shape. That helps to prevent it from rubbing on the top tendon. So think of it again like this, very simple. When you do it like this, you rub on the tendon. When you drop it down, you create more space to prevent it from rubbing on the tendon. So that's number one, simple exercise like when you're doing push-ups. Okay, some of the guys want to train the deltoids. We do what we call front presses. I'm going to show it to you now, how we actually do it properly. Again, this is for front presses. You want to protect your shoulders. When you do want to do front presses, don't do it with your arms flat out like that. So because when you do that, you can actually rubbing and impinging on your shoulder a lot more. Yep, you want to keep it with your elbow pointing, your elbow pointing forwards, and then you lift up like this in the front, and that helps to prevent impingement of the shoulder. Again, you do it slowly. The key word is to go it in a very slow manner. You go up, 1, 2. When you come back down, you go 1, 2, 3, 4. So this is the second thing that you can actually do to protect your shoulders by keeping it in the front. So if you think about it, when you do these exercises, you can actually protect the shoulder. You also can use it as a day-to-day thing. For example, when we all can go back traveling again now, when you carry your overhead cabin compartment luggage, as opposed to lifting up like this, you keep your elbow in front and you lift up like this. We call it, you clear the impingement. You prevent it from rubbing on the roof tendon. Okay, other things that we like to do is we like to actually do what we call a lateral fly. So this is, again, training your deltoid muscle. This is how we can do it to prevent the impingement. So when you're doing a lateral fly, you can do flies with a band also, you can see. You can thumb point downwards. That will make the shoulder go into what we call internal rotation. And when it does that, because of that, when the branch comes down and rub on the roof tendon, it impinges on the tendon and causes a lot of trouble. So you just turn the thumb upwards like this, and your whole shoulder actually rotates, it means turn outwards. And then when you move up like that, you can train the deltoids without impinging on the shoulder. Again, you do it slowly to prevent any injuries to the shoulder. Okay, that's how we preserve it. Now, how do you actually train the rotator cuff tendon? The main one that always gets kena injury is always the roof tendon, the top tendon. So how do you protect this top tendon? Let me show it to you now. So how do we train this tendon? We do, again, what we call the eccentric, which is slowly exercises, but we do what we call an external rotation. That means turning upwards exercise. Now, I'll show it to you. This is how we do it again. We use a band like this, okay, a TheraBand. Yep. And you keep your elbow tucked in as much as you possibly can, and you externally rotate. So you turn, you hold it in like this, keep it tucked in with your elbow tucked in, and then you turn outwards like this. You go out 1, 2, hold it for 1 second, and then come back in 1, 2, 3, 4. Again, you go out 1, 2, come back in 1, 2, 3, 4. So that's how we actually prevent that. Yeah. So you make sure your elbow doesn't come out like this. You just want to keep your elbows tucked in and you go externally rotate like this to help to train the roof tendon. Because by doing that action, training the roof tendon in this slow manner, it helps all those micro split tears actually seal back into each other. We always tell patients this, that the tendon cells, we call them tenocytes, are not the most smart cells in the body, not like brain cell or not like a kidney cell or anything. They're not very, very smart cells. They are just tendon cells that are very, very similar to your scar tissue cells. As long as you can nourish it and let it have good blood flow by doing this slow relaxing phase and let it glide, the tendons will heal by doing this particular technique. Okay, so I've talked about activity modification and how to preserve the tendons in the shoulder to help it last as long as possible, to train it as much as possible. Now I'll tell you how we can actually prevent you from getting what we call a rolled shoulder forwards like this by training the muscles around the shoulder. Because when you roll the shoulder forward like this, like Sharapova, you can see it goes forwards and it rubs on the front part of the bone here, and that puts it at a higher risk of rubbing on the tendon. So we want to do something called a scapular stabilization exercises, which is the shoulder blade. Around the shoulder blade, there are a lot of muscles. Your traps muscles, which is the one on the top here, your lats muscles, which is the one in the armpit area, and then the muscles between your shoulder blade, we call it the rhomboids. The idea is to get your shoulders to become down and backwards. Down and backwards. Not like this, but down and backwards. And how do we do that? I know a lot of guys do a lot of what we call a lats pull down. But again, when you do a lats pull down, you actually do impinge because it's an overhead activity. So we recommend what we call a seated row. And this is how I do it. Again, nothing complex. You can do this at home also with just a band. I can tell you that you can buy these bands very, very easily. You can go to Cool 10 to buy them. They're like not very expensive, like $10, $15 only. They're very, very cheap bands. You can actually use it. Again, you don't have to have very, very heavy bands. These are training small muscles that are in your body that you can actually use. These bands in a slow manner, you can actually train them quite easily. So this is how I do it at home. It's quite easy. So I'm seated down now. Yes, correct. You can actually sit down and then use the bands. And you want to train your lats muscles and the muscles between your shoulder blades, the rhomboids, we call it. So you want to pull and you pull backwards. You count 1, 2. You want to keep your elbow flushed with your body and not beyond because you don't want to overstretch the biceps. You pull again, 1, 2, pull for a second and come back down, 1, 2, 3, 4. Keep your shoulders down, not doing like this. You want to keep your shoulders down. You want to train the shoulders backwards. Hold for a second and then go 1, 2, 3, 4. Yeah, so that's how we actually do that to protect the shoulder. So the idea is, again, to get your shoulders to go downwards and backwards to make sure you end up like Ting Xiong, to hold your shoulders down backwards like this to prevent it from rubbing on the area. So these are the 3 simple ways that actually we can protect the shoulder. Again, as I said, activity modification. Secondly, train the rotator cuff tendons, protect it and preserve it, prevent it from getting any injury, and then train the muscles around it. There are a lot more techniques on how you can actually train the muscles, but these are simple things that you actually can do it at home, even now during this CD time. So that when you eventually go back to doing your sports, whether it is yoga or golf or whatever it is, you can actually get a stronger shoulder to get back to your preferred activity. Think about it this way. I always tell my professional rugby players, if you think about it now, when they go and play on the pitch right now, they may play for a few hours, 1 hour, 45 minutes, or even half an hour. But the amount of training they have to do off the pitch, we call it off the pitch training, is much, much more. This is to protect all their joints. And that is actually very important. And that helps to prevent getting injured. So the main thing we must realize is this. We will all grow old. We understand that. It is part and parcel of growing older. We will all start getting more and more injuries. The idea is not to not do anything at all. It is to build up so much so that as it slowly deteriorates, you have so much reserve so that you don't have to worry that it slowly deteriorates. And how do we do that? We start it from now. We protect the shoulders, we protect the joints, and make sure that you can last as long as possible. Until the day somebody can come up with bionic, not just the internal metallic one, I mean the entire replacement joints and everything that is like the whole arm is changed, then we can talk about it differently. But today, whatever we have, we protect it as much as possible so that we don't get into injury. As we go older, we protect it as much as we can so that we can give you as much activity as we can. So this comes to the end of what I'm talking about on 3 ways to protect your shoulder. Again, as I said, we have three doctors. We are pure shoulder elbow specialists. During this period of time, we understand that it is very difficult. If you do have any questions or anything, we do have colleague consult. It's something that we all are moving towards. I think that's actually very good. I think something that we can actually consider. And the last thing will be this. Any issues, you can just WhatsApp us anytime at this number. You can also just look up our email, our website at shoulderclinic.sg. We have a free PDF. If you want to find more information about the other shoulder injuries and everything, we have a free PDF there to find out more information about the shoulder. We have 3 clinics, one in Novena, which is where I am now. I've got another clinic in Gleneagles and another clinic in Farrer Park. At any point in time, if you need anything that you need to help, we can help you with, you can just email us, WhatsApp us, anything, whatever it is you need us, we can always be there to help you. Okay, so from now, I will stop my talk and answer any questions.
All right, man. I think first of all, thank you so much, man. Thank you so much. I think it was a very interesting talk itself. I think that, you know, to whoever feels that, you know, it was a good talk itself, maybe, you know, within the chat, you could probably put a clap, you know, inside there, huh? Yeah. I think that, you know, it was very informative itself. Yeah. I think that, you know, the entire talk itself was very, very informative. Helps a lot of us to clear a lot of our whatever misunderstandings or myth, you know, about shoulders itself. I am definitely one victim myself, you know. Yeah. So feel free, you know, whatever questions that you have, you know, you could probably put that inside the chat now. And then, you know, Dr. Roland could probably, you know, Roland could actually help to answer your questions. Yep. So we see, you know, you guys can put inside the chat, you know, or if you do not want to type itself, you could, yeah, you know, we see some claps, you know, coming, you know. If you do not want to probably fire your questions inside there, you could probably, you know, unmute your mic and then maybe you can ask your questions. Yeah.
I'm trying to learn how to use this room group chat also. Yes. Okay. I figure out. Yes.
Yeah. Great. You know, at the same time itself, well, I mean, we want to thank you, you know, in collaboration with Pathfinder, which is the organization that I come from itself, you know, so that, you know, everyone can really benefit from this. Okay, so we have got one question over there.
Yes, is the pain at the neck related to the shoulder? Okay, let me explain to you. The neck is so close to the shoulder. So very often we actually do get a lot of patients coming in and we're trying to figure out whether it is a shoulder problem or it's a neck problem. So number one, typically, neck pain can give you pain down the shoulder blade area and what we call the traps area. So typically they'll tell you that they've got pain here, got some pain here. They can have some pain even coming down the arm. That suggests to us that one of the nerves in the spine, the yellow color thing, is being compressed, by the disc or something like that. And that can give you pain down the arm and it appear as if it's shoulder problem. Again, shoulder problems will give you problems with lifting up your shoulder. For a neck issue to give you so much problem, so much weakness that you cannot lift up your shoulder, that means it's very, very, very bad already, essentially. Okay, having said that, sometimes shoulder pain, because you cannot lift up your shoulder normally, you tend to compensate. You do something called a shrug. That means you do this. And because if you keep doing this to compensate for the fact that you cannot move your shoulder, you can get a lot of pain around your shoulder blade and your traps area, which is around here, around the back of the shoulder here, and also around your traps area. So they can get a lot of strain, a lot of pain around the area. So that is something that is related. Again, to put it very simply, neck pain typically gives you pain when you're moving the neck. It may give you shooting pain down the hand if it's very, very bad. It may give you numbness or weakness of the hand. Typically, it occurs around the traps area, the shoulder blade area. Shoulder problem typically gives you pain around this area. It affects your ability to move your arm. Typically, it gives you a lot of problems going to the back, especially in a female when you're hooking a bra. That one is actually quite common that we do see. Typically, again, shoulder pain usually do not give you hand numbness or weakness. Again, this is general. It's not that everybody is the same, but typically that's what we are saying. Okay, I got another one from Huawei Mate 20 Pro. Is it normal to hear sound coming from the shoulder joint during daily routine? Okay, so whenever you have sound coming from the shoulder, we call it crepitus or cracking sound, like when you're doing that click, click, click. Okay, we always ask doctors, we always ask our patients, is the sound, the cracking sound, or the crepitus or whatever it is it painful or painless? When it's painful, we are very, very concerned. When it's painless, we are not that badly concerned. Again, what can cause the painless cracking of the sound? Again, the same thing when you're doing this and cracking and everything, is mainly because there's actually a vacuum in the joint that is popping one side as you move the joint from one place to another. That is one reason. Other reason is because you may have a previous injury and has some scar tissues around the area, and that scar tissue is moving and you can hear some popping sound. Between every joint, there's always, or every different parts of the body, there's something what we call a bursa, which is a thin film between two surfaces, and sometimes this thin film may rub on each other and cause some degree of cracking sound. So typically, if it's not painful, we are not too concerned. It may not be 100% normal, but we're not too badly concerned because it's not painful. If it's persistently painful, then we're very concerned. Why? Number one, is there something trapped within the joint itself that is causing it to jam and causing a lot of pain? Typically, we tell patients that if the cracking is painful, and you don't try to force through the crack because you may cause more damage to the part that we're talking about. So that's number one. Number two, is there actually a tendon around the injury that is actually damaged? If there's tendon that's damaged, of course, when you're moving, it becomes extremely painful. So again, if you split it clearly to painless versus painful cracking, then we kind of know what exactly to do. Okay, I got a question from DC. Constant dull aches, unbearable near my left scapula, strengthen or ease the pain. Okay, so again, when you have a scapular problem, there are a few issues that we're very concerned. Number one, is it a neck problem? Is it something that in the neck that is causing the impingement or the compression of the nerve that is coming down? And because the neck nerves all go around the arm area, we are always very, very careful about that. So typically in the clinic, we will ask, any hand numbness, any weakness, where exactly is the pain? Is there a painful spot or not? That's the most important thing that we need to be careful with first and foremost. If that is not really the case, then we start looking at other reasons. Yes, you can have what we call myofascial pain, some muscle pain around the area. As you see, you rock climb quite a bit. So the strain around the muscle area can actually cause a bit of discomfort around or pain around the area there. So you can try to actually do, as I told you, the scapular stabilization exercises to strengthen the shoulder blade muscles. First, the simple things that you can do. The other thing you can do is you can go to Q10 again or any of the website now, and then you buy those. Have you seen those spiky balls? The massage balls, the spiky one. You can buy those spiky balls and actually use it as a pressure point, a release point around the area, what we call a trigger point release. That may help you a little bit. If it's persistent, if you try that, say about 1-2 weeks, it is not helpful, it's still giving you a lot of problems, then we strongly recommend seeing a doctor. It's very simple. If you keep trying the same thing over and over again, it doesn't help, but no point trying again. Don't hit your head no more. That's the main thing I want to say. Okay, any other questions?
All right, great. Yep. Any other questions? Hope that all of you have benefited from this session. At the same time, wow. Okay, there's another one, man.
Okay. I fell down on my shoulder once in trampoline park, sharp pain, motion for 5 minutes. Went to the gym. After I healed, the bench press happened again. Yeah. Cold sweat and dizziness. Yeah. Should I go to the doctor? Okay. So the question comes down to this. It all comes down to function now. If you can say that I will never go to the trampoline park, I will never go to do a bench press again, it is pretty okay, my day-to-day life is pretty okay, and I'm quite happy with it, then you can leave it as that. That's not a problem. I do not know your age, I do not know your activities and everything, but if you find that I really want to go back and every time I try to do something, it becomes very, very, very uncomfortable right now, then I think it is affecting your function. So as I said, your activities of daily living, I will ask you the same 3 questions you can ask yourself too: wash hair, wear clothes, sleeping. Okay, not too bad, but I want to go to exercise and it's affecting my exercise. Then it's affecting you. Like for example, my rugby players, they have no problem day to day on, but they cannot play. So it is affecting them. Then we think that, you may want to see somebody to make sure that everything is okay. Okay, and the next thing, why does sometimes a neck jam? It radiates to the shoulder, okay. So again, that's the main problem. As I said previously, the neck is very close to the shoulder. It can be very difficult to sometimes separate out. So if you find that the pain is coming from the neck going down to the shoulder, especially when you're carrying weights and gyms and all, because when you're carrying the weight downwards, you're actually pulling on a nerve also. It can actually make it worse. So in those cases, then I would say that you should find out exactly what's going on. Then you may want to just to check the neck by a doctor or a GP or any doctor to make sure everything is okay. So that one is usually coming from the neck. Okay, anything else?
All right, man. Well, you guys have got Roland's contact over here. You can WhatsApp. You could probably go down to check it out. On their clinic website. You have got more specific inquiries. And I think that during this CB period itself, it's the best time to seriously realize your own problem and then help to resolve it. Yep. All right, man. So if we do not get more questions from here,
I think Jane H.C. Fong asking the recording. I think we will try to record it, then we may put it on the website, maybe on your site also once everything is done properly.
Yeah, great.
Yeah.
All right, man. Yeah. So,
Okay.
because you know there was a recording done itself. I think that probably they might post it up on YouTube, you know, on their own
Yes, we will
Facebook
put it
or
up.
something like
Yes.
this.
Yeah.
Yeah, great, man. Once
Thank
again,
you.
you know, thanks a lot, Roland, you know, for the sharing
Thank you.
itself. You know, I hope that
Yes.
everyone has benefited. This is not the last talk, you know, not the last time you'll see Roland. We'll probably be arranging a series of other talks itself, you know, to benefit, to improve, you know, everyone's health, you know, along this way. So do stay tuned, you know, to the consultant who have invited you in, you know, for this session. So we will keep you guys updated again. Right? Yeah. So do one for the back. Everything.
No problem.
Okay, man. Yeah.
No problem.
Okay, man.
So we will try to arrange. Yeah, no problem. Thank you, Desmond.
Sure. Everyone have a great day, man. Yeah.
Thank you so
Thanks
much.
a lot.
Thank you.
Okay.
Thank you.
Thanks. We will probably stay online to answer if there's any more questions. In the meantime, you know, everyone have a great day ahead, man.
Okay. Thank you. Thank you.
We have do one for the back. We have shoulder joint, you know, lie on the left side holding my phone, turn to the right. Yeah.
After I turn to my back, I feel pain. Yeah. So that one, it could be because when you're lying on the side, right now, what happens is that you may have jammed the shoulder and caused a bit of impingement. So I do see patients who get injured while sleeping also. So that's, if it's, again, as you say now, it is difficulties opening the door. If it's really giving a lot of problems, then yeah, you should consider seeing. Again, you can see that we're all looking at function. If you are functionally okay right now, then we okay, don't have to do anything. I do have patients with bad rotator cuff injuries, the tendon injuries, and they are good function. Then I say, hey, don't do anything about it. But if it's really affecting your function, then we find out what exactly is going on. We find out what the exact root cause is, and then we see whether that is the real source of the pain, and can we do anything about it.
All right.
Yep.
Okay, great.
Okay, thank you.
All right, man. I think that will be all. You know, thank you so much for your time again. Once again, you know, everyone have a great day. We'll see you guys around soon. Yep.
Yeah, thank you.
All right. Okay, thanks.